teams. This review will delve into the driving factors behind the rise of antibiotic resistance, its implications for infectious disease management, and the broader social and economic impacts. It will also explore potential solutions to combat this crisis, emphasizing a multifaceted approach involving healthcare workers, policymakers, researchers, and the public. Without further ado, we can get started. I'm pleased to introduce our presenter, Dr. Peter Eze, a lecturer and a researcher at the Department of Environmental Health Science at Nnamdi Azikwe University in Nigeria. His scientific background is in microbiology, biotechnology, and drug discovery research. His current research interests include bioprospecting for new drug compounds from microorganisms and the characterizations and epidemiology of multi-drug resistant bacteria in the environment. His findings have been published in peer-reviewed journals and presented in national and international conferences, and has received several honors and awards such as the European and Developing Countries Clinical Trials Partnerships Funds Award. I'd like to introduce Peter Eze. Dr. Peter Eze, you can start your presentation.
Yeah, thank you so much, Anne. Thank you. And thanks to Lavender. She's been great in helping me prepare for this meeting. And thanks for ARIN for providing this platform. I would like to ask, am I sharing my screen, or would the document I sent earlier be shared?
You can share your screen.
Okay. So, then I would take a moment, please.
Okay.
So I believe you can, I need to, okay. It's my screen visible.
Please, you can go ahead. Yeah.
Yeah, you can see me. Yeah. Okay. Thank you. Yeah. Okay. Thank you. So, good day, everyone. I would like to say my name again. I'm Peter Eze. I'm a lecturer at Nnamdi Azikwe University's Department of Environmental Health Science in Nigeria. And I'll be enjoying this opportunity to present today's ARIN review titled Antibiotic Resistance in Africa, Treatment Failures and Implications for Infectious Disease Management. We will discuss antibiotic resistance and its implication in Africa, We will examine the factors driving the rise of antibiotic resistance in Africa, as well as the social and economic impact of antibiotic resistance, emphasizing the link between antibiotic resistance and poverty and how it disproportionately affects the poor. We will then discuss solutions to mitigate this crisis. In the context of our discussion, we would use the terms antibiotic resistance and antimicrobial resistance, or AMR. We will use them interchangeably to mean the same thing. Antibiotic resistance is the ability of bacteria to survive and grow in the presence of antibiotics that would normally kill them or inhibit their growth. An estimated 1.2 million global deaths were found to be a direct result of antibiotic-resistant bacterial infection in 2019. A magnitude as high as major infectious diseases such as HIV, AIDS, or malaria. We can see from this figure here that death recorded globally due to antibiotic resistance is far higher than that caused by HIV and malaria, I would say. 1 in 5 deaths from resistant bacteria occurs in children under 5. Many more have suffered from resistant infections but recovered. On the left of our slide, we could see, and I would say in the course of my talk, we will see many drivers of antibiotic resistance and the consequences on both humans, animals, and the society, and the world at large. So we could see how antibiotic use in humans and animals could cause the survival and spread of bacteria that are resistant to these antibiotics, making the antibiotics less effective to treat infection, less effective to prevent infections. And this affects our healthcare system. This in turn affects productivity, affect income. So this is like the socioeconomic impact of antimicrobial resistance. What is antibiotic resistance? We've said this earlier, but I would use this slide to explain what antibiotic resistance is, how it happens, and the mechanisms through which it happens. Antibiotic resistance happens when bacteria change and become resistant to the antibiotics or to the drug that is normally used to treat them, or to treat the infections that they cause. And an illustration to describe how antibiotic resistance could happen is seen on the picture on the top left of the screen. From here, we could see that in a population of germs, there is a mix of both resistant and susceptible ones. Susceptible ones means those that easily succumb to antibiotic. Resistant ones means those that do not easily or do not succumb to antibiotics that are directed to treat infections they cause. So in this population of germs, a few may be resistant, a few may be susceptible. So when one is ill and one takes antibiotics, the drug kills both the germs as well as the good bacteria, which we normally know as the normal flora in the human body. The normal flora protects, has many, normally have many functions, one of which is protecting the body against pathogenic strains. So when you take antibiotics, maybe prescribed by a doctor or unprescribed, in many cases, the antibiotic kills both the pathogenic bacteria that is causing the infection, as well as killing some innocent ones, the normal flora. However, after taking these antibiotics, some drug-resistant bacteria emerge and survive. This could be because of many factors, such as the potency of the antibiotics, the quality, the suitability of the antibiotics, or even the completion of the course of treatment. Many factors could trigger resistance of a bacterial strain to the antibiotics that, many factors could trigger this ability of a bacterial population to select, to survive and to become resistant to the antibiotic that has been administered to treat infection they cause. The surviving resistant bacteria are now allowed to grow and take over and withstand these antibiotics. So, and then the infection that they cause persists. This means that the individual is still sick. The individual is not responding to treatment. So, elongating treatment times, causing more problems, causing wastage of money for treating and wastage of manpower. So in number 4, we can see that some of these bacteria have the capacity to transfer the their resistant trait to other bacteria in the same environment, including even those normal flora, the previously innocent bacteria can also get this resistant trait from the ones that already have them. So this is how antibiotic resistance can happen and spread and persist in an environment or in a biological system. I mean, a human or an animal body. Antibiotic-resistant bacteria can display resistance to an antibiotic or class of antibiotic via various mechanisms. And from this figure, we can see one of the mechanisms is modifying their cell wall permeability to prevent the entry of a drug. So a bacterium can just trigger a mechanism where the cell wall or cell membrane can become tough and antibiotics cannot penetrate. Another mechanism is the ability of the bacterium to modify the drug target to prevent drug receptor binding. So the antibiotic can come inside of the cell, but it cannot find where to bind. The usual, like a lock and a key. So the key is the antibiotic, the lock is the receptor, the target where the antibiotic is supposed to bind and cause action. So the antibiotic enters and is looking for the lock, it cannot find the lock. So the organism has changed the lock. So this is one of the mechanisms. Then another mechanism is enhanced efflux pump system. Bacterial cells have efflux pumps, and many of them can trigger this efflux pump to discharge or excrete or push away any antibiotic that comes inside. They just eject them out. Another mechanism is enzymatic degradation. Some bacteria have the capacity to produce or secrete enzymes that degrades these antibiotics and make them ineffective. Other bacteria could have resistance through mutation. Maybe a mutation causing a change in the genetic makeup, and the organism can just overnight just become resistant to antibiotic that it previously was susceptible to. Some bacteria could carry resistant genes in their plasmids, and in most cases, this plasmid can be shared. Like we mentioned earlier, sharing from one bacterium to another. But so this plasmid is scientifically defined as an extra chromosomal element. It's not part of the chromosome. It's a genetic material that is not part of the chromosome. It's existing outside of the chromosome, and it's easily transferable from one bacteria to another bacteria. Complex interaction are at play in the spread of antimicrobial resistance between sectors. We can see here how human activities, such as the use of antibiotics or agriculture, with an emphasis on the use of antimicrobials in animal farming, and as well as human activity in the pharmaceutical industry, like industries involved in production of antimicrobial drugs. We have situations where many companies like this have issues with proper disposal of their waste that contains antimicrobial substances or antimicrobial drugs. So sometimes improper disposal make this antibiotic enter the environment, enter water bodies, or enter soil. So all of this human activity, animal activity, link to both soil and water, which also link to wildlife. So there's a complex interaction involving all sectors of the environment. So we can see that antimicrobial resistance is a complex problem that is not only affecting humans. And if we think that it is, and we should understand also that the combating antimicrobial resistance should have all these sectors in consideration. So before we go to talking about antimicrobial resistance in Africa, we would have like a global overview of antimicrobial resistance. Antibiotic resistance kills. It's spread silently across the world. It is very costly. It is happening now. It is happening every day. It will continue to happen, and it will not stop until concerted efforts are made to curb or slow down this crisis. About 200,000 newborns are estimated to die every year from sepsis caused by multi-drug resistant bacteria. From the graph, we could see that after South Asia, Sub-Saharan Africa and Southeast Asia and East Asia, Oceania, recorded the highest mortality due to antibiotic resistance in 2019. More than 60% of the populations in some area carry multi-drug resistant bacteria in their normal flora. So I mentioned earlier that even the normal flora, the innocent bacteria, like the innocent bacteria, the ones that help maintain our health, many of them have acquired this resistant element from these pathogenic strains. So many healthy people, like healthy, so to say, many people are carriers of this multi-drug resistant bacteria, even in that is, existing amongst their normal flora. It is estimated that the median overall increased cost to treat a resistant bacterial infection is about $700 US, equal to over 1 year's wages of a rural worker in India, possibly in Africa. Novel treatment for infections caused by multi-drug resistant bacteria can cost up to tens of thousands of dollars, making them unaffordable for many. So it would be unfortunate maybe in a poor setting, in a resource limited setting, if somebody could suffer from an infection caused by a multi-drug resistant bacteria that can only be cured when one have to spend such amount of money. Many people would not be able to avoid this. Multi-drug resistance has already developed to the point that the last line of antibiotics have shown inactivity to infections like gonorrhea. I would like to point out, even from my own lab research experience, a last line antibiotic like colistin, I have seen lots of multi-drug resistant, like colistin resistant bacteria, and then I get scared when I see something like this. Then I'm wondering if somebody gets sick, by, with an infection caused by this bacterial strain, how can this person be treated? So this is antibiotic resistance is something that is happening, and it's very important that we are aware. And when we are aware, we can also help in creating more awareness. From this slide, we can see that it is predicted that in 2050, the global deaths by antimicrobial resistance would be 10 million, compared to about 1.2 million recorded as of 2019. So this is a crisis situation, and as of 2050, we can see that for Africa, about 4 million death is estimated. And this is comparable to what is estimated for Asia. So for Asia, for Africa, I think this is a very serious situation. Antibiotic resistance in Africa. Of all the World Health Organizations, the WHO World Region, Africa has the highest burden of AMR, antimicrobial resistance, AMR. Antimicrobial resistance imposes a huge burden on patients and healthcare systems in Africa. In fact, overuse, misuse, as well as lack of access to quality assured antimicrobials are the main drivers of AMR. AMR could kill 4 million people across Africa by 2050. We saw this in the previous. Developing countries across Africa could lose up to 5% of their GDPs as a result of AMR. The figure on the left, where we see the map of Africa, is an infographic from the MAP project, which is a multi-organizational, multinational consortium led by the African Society for Laboratory Medicine and funded by the UK's government Fleming Fund. On that infographic, we can see the DRI, which is a drug-resistant index scores of 12 countries in Africa. This DRI is used as a measure of antibiotic effectiveness, where the score of 25% or lower is indicative that antimicrobial resistance is under control. So out of 14 countries involved in the project, we can see that 12 of them shown, 12 of them have DRI above 25%. This indicates a worrying situation. So, yeah. So many factors contribute to antibiotic resistance in Africa. We will keep coming back and forth because all of these are intertwined. So we would mention mention one of the factors here. We would see them in another aspect. So all of these things are just intertwined. This helps us understand that the approach to curtailing this crisis is not strange. It is something that can be done. It only need genuine concerted efforts. Factors contributing to antibiotic resistance in Africa. One, overuse and misuse of antibiotics. This could happen when there is inappropriate prescribing, when people self-medicate, incomplete drug courses, when people don't complete their dosage. There are so many people who say they don't like taking medicines. I don't think a normal person would like to take medicines, but you have to take medicine when you're ill. And if you are taking antibiotic in this case, if you don't complete your antibiotic, it means that the drug regimen would not be able to finish eradicating the pathogenic strain. This means that the bacterial population that survives when you don't finish taking the course of your treatment would likely become resistant to that antibiotic because you've already exposed them to that antibiotic, but you didn't complete the course of the antibiotic to therapeutically, like to kill them to achieve therapy. Another factor is lack of regulation and enforcement. It's typical for many African countries. We have weak laws, weak regulatory framework to control our market, our drug market, the importation or the manufacture or the sales of or proliferation of quality of adulterated or drugs or product in the market. In many cases, we don't have strong laws or strong frameworks for enforcement of policies. We make policies. So many policies go into paper, but we likely don't enforce them. Another factor, substandard and counterfeit medication. This can also be linked to regulation. So when you take antibiotics that are not of good quality, this means that the antibiotic is not the potency, assuming you're taking an antibiotic that is not of good quality, maybe it's not up to the stated label, the stated dose. Maybe I would like a feedback if you can.
I can hear you.
Okay, all right, thank you. So substandard and counterfeit medicines could cause antibiotic resistance. This means that the medicines are not in the right quantity or potency or quality to effect treatment. So this means that the microbial population are exposed to sub-therapeutic dose. And they become, in this case, the bacteria would certainly become resistant to that antibiotic. Inadequate healthcare infrastructure. This is a situation for many third world countries. high burden of infectious diseases. All of these are linked. HIV, tuberculosis, malaria, when, you know, sometimes when people have situations like this, they take medications long-term, they take antibiotics long-term, and, you know, taking medications long-term can cause the bacteria causing the infection, as well as the normal flora in the individual's body, to become resistant. Also, these diseases condition listed, HIV, TB, malaria, could even cause co-infection. Many people who suffer from situations like this could have a secondary infection, a secondary bacterial infection that, you know, could require multiple and long-term course of antimicrobial therapy. And all these condition can cause, can expose the normal flora of that individual to resistance. Poor sanitation and hygiene. Poor sanitation and hygiene. It is understandable that this situation can cause the spread of infectious diseases in the environment, particularly infectious diseases caused by multi-drug resistant organisms. When there is inadequate water and sanitation, people are not able to clean up, people are not able to wash, people are not able. So if we can imagine how it would look like. Nosocomial infection, or infection that are easily spread in the hospital environment. When there is improper hygiene and sanitation in hospitals, when hygiene facilities or sanitation facilities are not available in hospitals, then hospitals become the dispenser of infection, is ironically. And then number 7, agricultural practices. Unfortunately, many people all over the world, this is not just a problem in Africa. I'm pretty sure from my previous studies, I've observed that this is even prominent in many countries outside of Africa, the use of antibiotics in livestock, in animal farming. In many countries, even in Europe, that does lot of animal farming. Many people, not only in Europe, in Asia, across the world, many people put antibiotics in animal feed. You know, they call it, they intend to, the intention for this is for prophylaxis, to prevent so the animals don't fall sick. But unfortunately, this is, like we mentioned, and like an individual taking antibiotics and not finishing their dosage. All this exposure means you are giving the bacterial population of that animal or of an individual sub-therapeutic dose, small dose. The bacteria, the normal flora, the bacteria, the microorganisms in that individual, they are exposed to this antimicrobial agent, these antibiotics, in small doses, and then they learn to overpower these antibiotics. They learn to become resistant to this antibiotic. And then using antibiotics in animal farming is an easy way to have them spread in the environment. Because these are the animal waste, so they all discharge into the environment. Also, lack of public awareness and education is a factor contributing to antibiotic resistance in Africa. Globalization and travel, cross-border movement, the movement of people and goods. It's easy now to travel, you know, from one country to another. An individual having multi-drug resistance in say, in China or Japan or America or the United Kingdom can easily travel to Africa and just share with somebody, or somebody somewhere in Nigeria can just, that has a multi-drug resistant, you know, bacterium, can travel maybe to these countries in China, like China, UK, and the rest of them, and also pass, Also medical tourism is also we mentioned about when people move from one hospital to another. If the hospitals don't have proper sanitation facilities, they could help to spread this infection from one country to another. An implication for antibiotic resistance is one of the implications is treatment failures. This means that the treatment is not working. An individual is being treated. It's say for an infection that it's known, maybe an infection which treatment course is known to last like normal 1 week dose is enough to clear. But after treating for 2 weeks, 3 weeks, the individual is still sick. This is just a simple definition of treatment failure. Antibiotic failure can be defined as any clinical situation where treatment with antibiotic fails to cure the patient and remove the infection. As a result of drug resistance, antibiotics become ineffective and infection become difficult or impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. Failure to respond to treatment leads to a long illness and a higher chance of death. Implications of treatment failure due to antibiotic resistance include prolonged illness, increased mortality. Infections caused by multi-drug resistant bacteria can be more difficult to treat and can have result to higher risk of complication and death. Example is like the the methicillin-resistant staph aureus, the MRSA. Another example is tuberculosis caused by the multi-drug resistant Mycobacterium tuberculosis. Tuberculosis is known the treatment course for tuberculosis is known to take months. So you imagine when an individual is sick of a multi-drug resistant TB. This means the treatment could take even years. If, this would be a terrible situation. So this could lead also to higher healthcare costs, limited treatment options. Like I mentioned that I have seen microbial strains that are resistant to first-line drugs, last line, I mean to say, the last option, like last-line antibiotic like colistin, last-line antibiotics like the carbapenems, like meropenems, these last-line drugs are very expensive and they are like very potent, but then there are strains, there are microbial bacterial strains that are resistant to antibiotics in this class or classes. So this means when an individual is sick, having an infection caused by a bacterium that is resistant to colistin, the option, what next? What else can be used to treat the individual? This would be difficult situation for the healthcare professionals to decipher. So this situation limits the treatment option. There's increased risk of spread. There's complications in surgery and chemotherapy. And then there's a possibility for the use of toxic drugs. This means that many of these last line antibiotics, antibiotics of last, I'll just informally refer them as antibiotics of last option. Many of them could be toxic, because in drug discovery, there's what we call risk benefit analysis. we mentioned earlier that antibiotics have the possibility to eradicate both the bad germs, the bad bacteria, and the good ones. In many cases, they could have side effects on the individual taking them. So, but when the benefit outweighs the risk, the drug can be approved as medicine to be administered to individuals. So, but there are many antibiotics that they could harm both the pathogenic bacteria, harm both, and also harm the normal flora, and to a large degree harm the patient. So these kind of drugs are normally not used. So, but when the good antibiotics, so to say good antibiotics are not working, the clinicians may be left with options to use the toxic one. So the individual may be treated of the infection, but they may end up having liver damage or kidney damage or something like that. Specific examples of treatment failures caused by multi-drug resistant bacteria can be seen from in tuberculosis caused by, particularly those caused by multi-drug resistant TB, urinary tract infection, particularly those caused by the extended spectrum beta-lactamase producing Enterobacteriaceae. This kind of beta-lactamase, like one of the mechanisms of antibiotic resistance is enzymatic degradation. Beta-lactamases are enzymes that so many bacteria, particularly gram-positive bacteria could produce them to, gram-negative bacteria could produce them to degrade antibiotics of the beta-lactam antibiotics, the penicillins, the cephalosporins. These are antibiotics in the class of called the beta-lactam antibiotic. So these enzymes have the capacity to degrade these antibiotics and make them inefficient. So now we see there's a class of beta-lactam is called the extended spectrum. Extended spectrum is these enzymes have the capacity to degrade a wide range of beta-lactam antibiotics, a very wide range, penicillins, cephalosporins, a lot of them. So, and so many bacteria in the class, in the family of Enterobacteriaceae, the E. coli, a lot of them have this capacity, Klebsiella, and a host of others in this Enterobacteriaceae. They have the capacity to produce this enzyme. And UTI, urinary tract infection, caused by organisms like this are common. There's been many cases of people having UTI that is difficult to treat. So this is very common. So we can also, another example is pneumonia caused by drug-resistant Streptococcus pneumonia or Pseudomonas aeruginosa. Sepsis means infection in the blood. Sepsis caused by drug-resistant bacteria like the MRSA we mentioned earlier, or the carbapenem-resistant Enterobacteriaceae. Carbapenem is one of the class of antibiotics that are normally considered last-line antibiotics. An example is the imipenem and the meropenem. These are last-line. Unfortunately, there are bacteria that are resistant to these antibiotics. It will be a terrible situation when an individual is having sepsis caused by the bacteria in this group. Now we have talked about, we have had like an overview of antibiotic resistance globally. We have touched on antibiotic resistance in Africa. We have gone into the like a little detail into the scientific description of antimicrobial resistance and how they occur and how it could result in treatment failure. Now we would look at the public health implications of antibiotic resistance in Africa. Antibiotic resistance poses significant public health implication in Africa, impacting clinical outcomes, healthcare system, and broader societal aspects. Key implications include increased morbidity and mortality, which could be as a result of treatment failure. Prolonged illness and complication also could be as a result of treatment failure. So prolonged illness could, reflect in complications, causing chronic disease condition. It could cause increased healthcare costs, resulting in the use of more expensive drugs, extended hospital stay, meaning more hospital bills to pay, additional diagnostic tests to undergo, more expenditure, on the patient. Then the strain on the healthcare system. So you can imagine on a let's say an epidemic scale, maybe when there is it would be an unfortunate situation. Maybe there is a cholera outbreak or an outbreak where the bacterial strain is multi-drug resistant. Then the hospitals would be strained because when more people are not responding, when many people are not responding to treatment at a time, this means they stay longer, the beds are occupied. So when newer patients are being brought in, there's no space. So so the hospital is overburdened, the clinicians are tired, they are overburdened, and yeah. So then there's impact on public health programs, other public health programs, like when the healthcare system is strained, they may not have the capacity to undertake or, play a role on other public health program pertaining to TB or HIV or malaria or COVID or some situations like that. Number 6, spread of resistant pathogen. This is a public health issue where this spread can move from one community to another, from one hospital to the community or to another hospital. Maybe a patient is transferred from one hospital. Maybe the patient could not be treated in one hospital, and then the patient is referred to another hospital, and then the referred patient takes this acquired resistance from the former hospital to the new one, and then the other patients and the healthcare workers there become infected. So we see also cross-border transmission, one country to another. And also the impact on vulnerable population, children, immunocompromised individuals, like those suffering from who are on cancer chemotherapy, or those who are suffering from HIV and AIDS. They could have co-infection, then the elderly. Then there's also economic consequences. Like I said, we will keep coming back to all these phrases, terminologies, all of these things. We will keep mentioning them in our slides. Loss of productivity, more money to spend, as a result of prolonged hospital stay, ineffective, as a result of treatment failure also. Then challenges in outbreak management. This is also linked to the strain on healthcare system. This is also linked to the impact on public health programs. So there would be a strain in difficulty because the healthcare system is already stretched. Then there's also a challenge on global health security. Multi-drug resistant strain could be a bioweapon. Implications for infectious disease management. Antibiotic resistance in Africa has significant implications for infectious disease management, affecting both clinical outcomes and public health strategies. We will look at clinical implications. One of them is limited treatment option. We increase healthcare cost, treatment failure. I think the term treatment failure is very important in this presentation. It is the direct, I would consider it the direct implication of multi-drug resistance or antibiotic resistance. And this treatment failure is now causing death. It's now causing prolonged hospital stay. It's now causing, I would say, wastage of money and manpower, and and the host of others. So, and then another implication for public of antibiotic resistant and infectious disease management is the public health implication. We've mentioned this in the previous slide. Socioeconomic implication, impact on productivity, livelihood, poverty exacerbation. So it's when people are ill, they don't work and they're spending what they already have. So it could cause poor people to become poorer. Then global health security, we've just mentioned it. Then it is important to mitigate this. We would come later on to preferring solution, but it is important to highlight here that healthcare systems should be strengthened. There should be government and policymakers and healthcare workers and people who have a voice should promote rational use of antibiotics. There should be investment in surveillance and research, particularly research in understanding the mechanisms of antibiotic resistance in a particular situation. Every situation, like there could be an outbreak. You don't just empirically, in the past, it's normally happening in in poor resource settings, limited resource settings where there are no proper, good laboratories to evaluate or to test if the infectious agent is resistant or susceptible to a particular antibiotic. So in this setting, doctors just use empirical, treatment method. They just administer antibiotics. In most cases, they administer the broad spectrum antibiotics. And sometimes these antibiotics don't work because maybe the individuals are being sick by a resistant organism, and then this broad spectrum antibiotic could even make that particular organism to become multi-drug resistant. Multi-drug resistant means it's not only resistant to one antibiotic, but to 2, 3, 4, 5, as many as it could be. So an antibiotic resistant bacteria could become multi-drug resistant bacteria. So they could become multi-drug resistant bacteria. So research is important. Research is important in drug discovery, in understanding how antibiotic resistance is happening, in understanding or how what system would work in mitigating antibiotic resistance in a particular environment or in a particular situation. Also enhancing public awareness. Here we would look at the socioeconomic implication of multi-drug resistance or antibiotic resistance in Africa. A failure to address the problem of antibiotic resistance is predicted to result in about 10 million deaths by 2050. Which would result in a cost implication of 66 trillion pounds. So this is an estimation by the UK government. Having effective antibiotics is a prerequisite for successful achievement of many of the global sustainable development goals, including goal 1, no poverty, goal 2, zero hunger, goal 3, good health and well-being, goal 8, decent work and economic growth, goal 10, reduce inequality. We can see how all these are intertwined. We've discussed all of this in our previous slide. So antibiotic resistance could cause death. And the implication of this the cost implication is, as we've talked, 66 trillion pounds by 2050. And this situation could affect our capacity to achieve the majority of the SDGs. In this slide, we can see that antibiotic resistance is often wrongfully depicted as purely a medical problem. I believe we have been able to convince you that to understand that it is not only a medical problem, it is also a socioeconomic problem. It is also a problem for a political problem. It is a problem that can be explained in many dimensions. So we can see from this figure that it's linked to poverty. It's linked to economic growth, as it's also linked to it affects universal health coverage, it affects health equality. So it's all connected. So what are the challenges in managing antibiotic resistance in Africa? Managing antibiotic resistance in Africa presents numerous challenges, such as looking at healthcare infrastructure. We have inadequate healthcare facilities across many countries in Africa. Many healthcare facilities lack essential resources, including proper diagnostic tools or laboratories. And these are crucial for identifying infections and determining appropriate treatment. Many African countries have limited access, like people in many of these countries have limited access to healthcare, particularly in rural settings. This access to healthcare services is often limited, leading to delayed or inappropriate use of antibiotics. Also, the shortage of trained healthcare professionals. Also, the issue of surveillance and monitoring. Many countries in Africa lack robust systems to monitor antibiotic use and resistant patterns, making it difficult to track the spread of resistance and develop effective interventions. There is inconsistent data collection and reporting practices. So many, there are many of the data collected in many healthcare facilities don't go outside of that facility. Many don't even collect data. So it's hard to know what's happening at in a particular place at a particular time. Also, public awareness and education. Many people don't understand this situation. Many people don't. Many people, it's still common practice, even in the developed world. But it is, I must acknowledge that many developed countries, they have tight control for antibiotic prescription. You can only get antibiotics and certain kinds of drugs when you can only get them when they are prescribed by a doctor or a pharmacist. So, but unfortunately, in many countries in Africa, these kind of law or regulations are not very strong. You could just get antibiotics, even including the last line antibiotics. You could just get them from the pharmacy store or drugstore across your by your corner. So,
Peter, sorry for the interruption. I just checked the comment section. I've just texted you something there, and maybe if you can revert to it.
Yeah. Okay. All right. Thank you. So, so then the issue of antibiotic use in agriculture, the economic, social factors. So when we're in a poverty in a poor setting, people may not have the facility for proper hygiene, which is also linked to infection control and hygiene. Lack of funding by government and funding organizations to support research in drug discovery and in antibiotic resistant mitigation, as well as the issue of global regional coordination. Many countries in Africa do not cooperate or have a coordinated system to share data and combat, particularly to combat this kind of situation. So there are many strategies to combat antibiotic resistance. One of them is the One Health approach, which is an integrated, unifying approach that aims to achieve optimal and sustainable health outcomes for people and animals and systems. So the One Health shows how the environment, humans, and animals are connected. It recognizes that the health of animals, the health of humans, as well as that of animals and plants and the wider environment are closely linked and interdependent. So when we understand this, it will help all countries and policy makers and researchers to adopt approach that would be to adopt holistic approach. So we all have roles to play, not just the government, not just the research. The healthcare professionals have role to play. Appropriate prescription of antibiotics, as well as we've mentioned all this previously, infection prevention and control, undergoing continuous education and training in this aspect to understand, because antibiotic resistance is happening. It's happening. New drugs are coming up. The organisms, the bacteria are becoming resistant to these drugs. So the healthcare professionals should know what drugs are working and what are not working. Community engagement. It's everybody is involved in this. Public awareness campaign, raising awareness about antibiotic resistance, educating communities about proper use of antibiotics, promoting responsible use of antibiotics, surveillance, research, innovation, technological solutions. We've mentioned this before. So this is, all of these are what we government, everyone, whomsoever we have the opportunity to talk to, we should adopt innovations in surveillance, in research, in technology to solving this problem. I mentioned previously about enhancing regional and international collaboration amongst African countries, sharing of surveillance data, sharing of research findings, policy regulation that connects not only one country, but other country and globally, you know, and as well as making funding available, not just for one country. Funding could be made available from many countries to undertake research that would impact on the countries involved and the world at large. All of this, all of our discussions, all of what I've been saying could influence policy making. So those involved, the policymakers, the government should take this message and make the necessary changes. One of them is, although the majority of the country in the WHO Afro region have already developed the National Action Plan for mitigating antibiotic resistance, but many of them are yet to implement, or even when they are implementing, they don't monitor the implementation. So it would be nice, it would be good if countries take this serious and they work towards implementing the component of their national action plans. As antimicrobial resistance advances, we need action to stop this catastrophe, having in mind that it is predicted that by 2050, about 10 million people could die across the world. So this should always motivate, this should stimulate consciousness to action. I've mentioned National Action Plan on antimicrobial resistance. These are comprehensive strategies developed by country to address the growing threat of antimicrobial resistance. So I've mentioned previously, as of 2017, Ethiopia was the only African country to have a national action plan. As of 2022, we are lucky about 42 countries out of 47 countries have already a national action plan. Some of them, out of these 42 countries, only 11 of them have implemented a context-based antimicrobial resistance campaign. Only 6 of them have implemented antimicrobial resistance stewardship intervention. And only 6 of these countries have implemented and integrated antimicrobial resistance surveillance in the context of One Health approach. I would like to conclude by letting us understand that resistant bacteria do not respect borders. Their spread is the stark reality of our interconnected world of trade and travel. So resistance originating from one place can spread rapidly worldwide. This means that the misuse of antibiotics anywhere in the world, anywhere in Africa, is enough to overturn achievements in containing resistance elsewhere. So it's the whole world, the whole African country should have this in mind and put hands together. From the figure on the right side of my screen, we could see that antibiotics are the cornerstone of medicine. As from cancer treatment to complicated surgery, organ transplantation, and all of them, we see that antibiotics are what's holding all this, because all of this in place. If not, the patient could get infected and by secondary infection or co-infection, and the efforts to cure the cancer or to transfer the organ, all of them would be wasted. So these are few personal nuggets for individuals to prevent on individual capacity. Practice frequent hand hygiene, Do not demand antibiotics from your doctor. Do not coerce your doctor to give you antibiotics. You should allow the doctors to determine if you need antibiotics. Follow your doctor's advice when taking antibiotics. Do not stop taking antibiotics by yourself. Do not stop even when you think you're feeling better. Finish the course of the dosage. And with this, I would like to conclude and say thank you for this opportunity. Thank you for your attention. Thank you.
Thank you, Dr. Peter Eze, for this insightful presentation. It's clear that antibiotic resistance is a complex and a multifaceted issue, and not only is it a medical and public health challenge, but also a socio-economic one as well. We now open the floor for any clarifications, comments, or questions regarding the presentation. And to get us started, I will go first. As you have mentioned, the high overuse of antibiotics has led to the increased resistance and high prevalence of multi-drug resistant infections. And this has led to the cease of stocking up of some antibiotics in Kenyan hospitals as well as Kenyan pharmacies, for example, the azithromycin. And as you might be aware, there is a global increasing interest in utilizing monoclonal antibodies in antibiotic therapy due to the low off-target effect, high tolerance, as well as high specificity, and they could have less resistance. And we have some of them that have been approved by the FDA, for example, the antibiotic which is used to treat inhalational anthrax in combination with appropriate antibiotics such as ciprofloxacin. And considering now the high carbon footprint associated with the production of monoclonal antibodies, as well as the high economic costs, what strategies can be implemented to mitigate these environmental and economic trade-offs while maintaining their crucial role in treatment of multi-drug resistant infections?
Oh, sorry. Yeah. Yes. Yeah. So thank you, Anne. I really thank you for touching this aspect of the availability of alternatives, monoclonal antibodies, other alternative treatment, even traditional medicine. There are also traditional medicine that are effective, even though there's the challenge of standardization is affecting that sector. So I must. It's unfortunate that this availability or the use of these monoclonal antibodies or many innovative products in the market are not readily available to poor people because this is very expensive, like you rightly mentioned. So it would certainly go back to the funders, the government, the big funders, because like we see that like the HIV medications are subsidized by many government, by many NGOs. So like we saw the COVID vaccines when during the pandemic, many governments and NGOs funded these vaccines and made them available. So this could be a situation where this expensive drug, particularly for people who are resistant to the last line of available antibiotics, then I would like to recommend that our traditional medicine should be standardized. I have many Chinese colleagues, and I have also worked with them. I have learned also from them that, I've observed that their Chinese traditional medical sector is highly standardized, highly regulated, and it's working for them. So, and many people from the West even travel across to China to get some form of Chinese medical treatment. So we could have like also the Indians have this Indian I don't remember the term the terminology, the Indian So African medicine could move from the secrecy of the sometimes it's so we could move from this system where people hide the science behind their product, or there's like a cult like aura around a certain doctor or so. If we can achieve standardization of our traditional medicine, this can help. This can help. This can also help us to have cheap alternative treatment. So all of this is supporting my recommendation for research funding for research. We can go into researching our traditional medicine. Yeah.
Thank you, Doctor, for that insightful answer on leveraging Ayurvedic medicine as well as traditional medicine to combat antimicrobial resistance. At this particular point, I would welcome anyone with a comment, a clarification, or a question before I welcome Dr. Agevi to give his comments. If there is no one with a question, I would welcome Dr. Agevi.
Yeah, thank you very much. I think the way you have brought out this presentation was quite insightful, because you have brought it out in a way that even those people who are not in the field of medicine are able to understand this area. And it is quite interesting that even just apart from us talking about HIV and other pandemics, antimicrobial resistance is also maybe another pandemic that we really need to address, because when you look at statistics, for example, we have had high rates of antimicrobial resistance, for example, in South Africa, where pathogens leading to maybe E. coli, Staphylococcus aureus, for example. In Kenya, we have had issues like, for example, the TB, among others, have been reported as examples of AMR. So the way you have brought it out, it is important for us to look at ways in which you can address this issue so that it reduces the aspect of morbidity and also mortality rates. And also, it also reduces the costs that we use in trying to treat this particular menace. And I'm happy that you have introduced the issue of One Health as one of the ways in which you can address this. And I'm happy because if we really implement the issue of One Health, then we shall be able to even increase the aspect of maybe surveillance, so that we are able to understand maybe the people who have been maybe affected, or how can we address it. And maybe lastly, I'm happy also you have brought in an issue of research. It is important that countries in Africa need to invest. Now the countries need to invest. The countries need to invest in research, because when we invest more in research, we shall be able to address even the potholes or the gaps that are there. And with that, we shall be able to feed into policy so that we are able to address it at policy level, and that will be good, and it will even the mortality rate. So that presentation, to me, it was very insightful, and it is important for us even go further and find out now what gaps have we not addressed, and how can we communicate this even to the other people, maybe policymakers and other maybe stakeholders so that this information reaches them. It doesn't only remain in this review presentation that we have had today. So thank you very much. Yeah, thank you very much. Yeah.
Thank you, Dr. Gave, for your insightful comment. At this point, I welcome Dr. Akinyi to close us off as well as give her comments. Dr. Akinyi.
Thank you
Dr.
very
Akinyi.
much. Yes, I'm here. All right. So thank you very much, Peter, for those insightful, for that insightful presentation. I have to admit that this was a very steep learning curve for me because health in itself is not my area of expertise, and it was way above my ability. And I'm glad that just like Dr. Gaby says, just like Dr. Gaby says, you made it simple enough in a way to the point that to the extent that some of us who are quite lay in this area could understand. So just some once again, thank you for that. So just some housekeeping issues in relation to the fellowship program. I'm glad that more and more presentations that are coming up the past few weeks and months have actually been very interdisciplinary, and I am glad that today's review was also captured that, because if you look at the aspect of antibiotic resistance, I mean, one is just likely to look at it from a point of health generally, but not the socioeconomic aspect of it. So it was really insightful for me to understand that today. And so thank you for that. And I like how interdisciplinary that was. So to those, just an announcement, those who are interested in health issues more broadly, we're about to launch one of the biggest fellowship programs in Africa on climate and health. And this is a fellowship program that will be run collaboratively with other partners, and that includes Johns Hopkins University. So we hope that we'll receive as many applications as possible for these opportunities, and we'll be launching this on 19th of July next month. And we'll be launching that together with the other mini grants that are available. And those include the SDGs, accountable adaptation, biodiversity fellowship program. So we have a number of mini grants. In short, we have a number of mini grants in place for our fellows. So we hope that once we'll be making that call for all of us to attend on that day, and thereafter, you all will be able to attend and actually take advantage of these opportunities. The one that is quite close is the LIPS mini grant, which will be the LIPS mini evidence informed policy mini grant. So this will be launched on the 25th of July, or 25th of June. That is in the upper week. It will be on a Tuesday. So we hope that we will be able, our fellows will be able to apply for these opportunities, including you, Dr. Eze, because it has an aspect of sexual reproductive health. So I believe that is one of your areas of expertise. So, and my final announcement relates to the Learning and Exchange Forum that we'll be having on the 28th of June, also in the upper week, 2 days after the launch of the LEAP mini grant. So this, although it doesn't fall under the health docket, it falls under just energy transition. and we will be having a number of speakers that have already confirmed. It will be something so grand, and blogs that have already been submitted. So we hope that all of us, we continue spreading the word, that all of us be able to attend this particular event. So far we have 2 big events for our fellows this month. And the next month, we're hoping that we've already talked to the deputy regional focal point for East Africa, for West Africa, Anglophone West Africa, and the Francophone, the diaspora, the Southern, the Central. And they already have a work plan on how they're going to run some of the activities that we'll be having for our fellows once every month. So this will be more monthly convenings on various topical issues that are of paramount importance to Africa. So we hope that we continue spreading the word about the fellowship program, and so that we also mobilize more attendance to these Friday reviews, because as today, as insightful as today's presentation was, we noted that the attendance was not so good as we had expected. So we hope that with time we continue spreading the word about the Friday reviews and more mobilizing others also come. Otherwise, time is fast spent, and just want to wish all of us a very wonderful and blessed weekend ahead. And to the Kenyans and Muslims around the world, we wish you a beautiful holiday on Monday. And I'm not so sure if Lavender, there's anything else that needs to be done, maybe photo session. Or Anne, if you
Yeah,
can.
Dr. Kini, I would request everyone to turn on their cameras and smile for a group picture. And maybe Gogo, you could help us with taking the picture. Antonina, maybe you could tell us once you take the picture. Thank you, everyone.